and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Welcome to the December 10th, 2025 regular meeting of the Washington Township Healthcare District Board of Directors. Public notice for this meeting has been posted appropriately on our website. Tonight's meeting is in person and also accessible by Zoom. I ask that you please mute your system until such time as you need to speak. We are recording tonight's regular session of the board meeting. It will be posted on our website for future viewing. Carol, please take the roll.
Director Wallace?
Present.
Director Nicholson?
Present.
Director Yee?
Present.
Director Stewart?
Present.
Director Eben?
Present. Thank you. We are now going to move to the election of our officers.
Thank you. Mr. President, I move that the Board of Directors approve the following slate of officers for the Washington Township Healthcare District Board of Directors. As President, William Nicholson. First Vice President, Jeannie Yee. Second Vice President, Bernard Stewart. Treasurer, Jacob Eben. And Secretary, Michael Wallace. This is for the year December 2025 to December 2026.
Thank you. Second. Thank you. Cheryl?
Director Wallace?
Aye.
Director Nicholson?
Aye.
Director Yee?
Aye.
Director Stewart?
Aye.
Director Eben?
Aye. Okay.
I thank Mr. Wallace very much.
Thank you.
Thank you very much.
So Mike, before you turn over the gavel, I'd like to just really thank you on behalf of the whole board for all that you've done. Your exceptional, exemplary, thoughtful, and insightful leadership. It's been quite a year. We've done a lot. We've done a lot of productivity initiatives. We've brought on new providers and physicians. We have 2 new facilities opening up, the Cancer Center and the Urgent Care Center, and perhaps the pinnacle of the accomplishment month, passage of Measure B. Thank you for all of that.
It's a pleasure working with you all the time, and forward to another great year of work with you.
Yeah, lots of work to be done.
Yeah, a lot of work. 2026 is going to be a good year. Here, that's your coffee, Mike. There's your water. Oh, very good. I think mine is unopened. Yours is probably unopened, and so we're all still good. Very good. Well, thank you all for your confidence in allowing me to serve in this position, and I'll be certain to call on all of you for your guidance and assistance and wise counsel. So now we'll move on to our communications section of the agenda. Oral communications. Members of the public are invited to speak during oral communications. When prompted, please state your name for the record, then proceed with your statement not to exceed 3 minutes on issues or concerns not on the agenda and within subject matter of jurisdiction of the board. Are there any members of the public who would like to speak at this meeting? Seeing none, Cheryl, are there any written communications?
There are none.
Very good. We'll now move on to our consent calendar. The consent calendar consists of those agenda items that the board will approve with one motion unless either a member of the board or a member of the public requests to remove an agenda item from the consent calendar. If any items are removed from the consent calendar, the board will take action on the removed agenda item later in the meeting under the action item heading of the agenda. Does anyone on the board want to remove an agenda item from the consent calendar? Seeing none, does any member of the public want to remove an agenda item from the consent calendar? Seeing none, may I have a motion to approve the consent calendar items A and B?
I move that the Board of Directors approve consent calendar items A and B.
Second.
Cheryl, if you could.
Director Wallace?
Aye.
Director Nicholson?
Aye.
Director Yee?
Aye.
Director Stewart?
Aye.
Director Eben?
Aye. Thank you. The calendar is adopted. We'll now move on to our presentations, and Kimberly, if you could introduce Will.
Yes, thank you. It's my pleasure this evening to introduce Will Cobb. He is a partner at PricewaterhouseCoopers in their health industries group that is based in San Francisco. He has 27 years of experience serving clients primarily in healthcare, nonprofit, and governmental industries. Will received his undergraduate degree and graduate degree from Auburn University. He is a certified public accountant and a member of the American Institute of Certified Public Accountants. He has significant technical accounting and financial reporting experience related to healthcare, governmental, and not-for-profit entities. He has extensive experience with bond offerings, affiliated foundation audits, and complex healthcare industry accounting and audit matters. Will has served as the district's external audit engagement partner since 2020. And he, this evening, is going to present to the board for the results of our annual audit for fiscal year 2025. And as you can see, it is also a consideration for an action item that we can decide to support. All right, Will, thank you for being here this evening. I'll turn it over to you.
Great. Thank you, Kimberly. It's good to see everyone. And if it's okay with you, I'm going to share my screen and walk through the presentation. Okay, so this is the time of year when we are presenting the required completion communications to the board, so the results of the 2025 audit. And, first off, just want to say no significant issues, no concerns, and really appreciate management's assistance. I think as we say each year, we understand that all these folks already have a day job, and audit is sort of on top of that. In addition, some of the finance transformation objectives that Ajay is leading. I wanted to specifically call out Melissa Garcia, your controller, for all of her hard work in supporting all of our information requests. And I'm happy to report that we have received complete cooperation of management and access to books and records. I'm going to hit some of the high points here, and certainly if there are questions, please stop, and I'd be happy to address them. So we are in a good spot in terms of the audit, the status. We're wrapping up procedures and going through what we refer to as our keeping current procedures, final tie-outs. If there's any significant updates, I'll let the board know, but I don't anticipate any changes at this point in time. We have no audit adjustments to report to the board, so very clean audit from that perspective, and we do anticipate issuing an unqualified audit opinion. I'm able to report that there were no material weaknesses in internal control that were identified during the course of our procedures. There were a couple of new accounting pronouncements, in particular a compensated absences standard that the district adopted, and that had an immaterial impact on the district for FY25, and we appreciate management working with us through the process of adopting that standard. And happy to report that there are no issues with respect to auditor independence that we need to report to you at this time. I will walk through the risk and results of what were referred to as the significant risks identified in the course of the audit. And we've been through these before, but just as a reminder to the board, the significant risk in management override of controls is required to be defined as a significant risk in all financial statement audits. It's really as a result of auditing professional standards that were issued as a result of some of the corporate frauds in the early 2000s. So the fact that this has been identified as a significant risk should not be alarming to management or the board. Nevertheless, we do design our procedures to evaluate the risk of fraud, and pleased to report that there were no instances of fraud identified as a result of our audit procedures. The second significant risk is really a standard industry significant risk, and that is the valuation of patient accounts receivable. As you all know, healthcare industry in the United States, highly complex and involves significant estimates and judgments with respect to valuation of those unpaid patient receivables coming from, mostly third party or government payers. And so this is a significant risk, really what we see consistently in our healthcare provider audits. So again, the fact that this has been identified as a significant risk should not be alarming. It's expected. And the processes and controls in place that we've evaluated are effective. And through the results of our audit procedures, we found the patient accounts receivable balances to be reasonably stated. This next slide has a bit more detail in terms of some of the procedures and the results of that work. I mean, one of the key procedures is we evaluate subsequent cash receipts after June 30, how that comes in relative to the balances that were estimated on the general ledger. And again, those amounts were determined to be reasonably stated. We also liquidated the prior year fully receivables and seeing how that played out over a course of a 12-month period. And again, we found that the previous year's balance was also reasonably stated. So I think you've got good processes and controls with respect to revenue cycle valuation, which of course, critical area of your operations, as I'm sure you agree. Significant estimates, we're obligated to report to you significant estimates that are identified during the course of the audit. And so, of course, the area of actuarial estimation is considered a significant estimate. The district utilizes external actuaries to help to assess certain key assumptions that management is taking responsibility for and building those actuarial valuations. We, in turn, also utilize our own actuaries to evaluate the district's actuaries and found that those estimates and the assumptions identified were reasonable. Other required communications, there's a sort of a laundry list, if you will, of completion communications that we're obligated to make to those charged with governance. And those are included in these materials. And what I can tell you is, without reading them word for word, these are all the responses that you would expect and want in terms of we received the complete cooperation of management through the course of the audit. The accounting policies, the disclosures were determined to be reasonable. No significant disagreements of note to mention to you. So again, if there was something that I felt like I needed to bring to your attention, I probably would have done it before today, but happy to report that there are no such issues. So again, it's just, I'm not going to read all these, but these are all just the very standard required communications that you would want. In the appendices, I have included, one, our audit quality report draft. We are in a regulated profession, and so we implement certain quality control measures to ensure that we're performing quality audits. So, happy to have you review that at your leisure. The audit report draft, as I mentioned, is anticipated to be an unqualified opinion. You see that in sort of the second paragraph of this letter, this very standard letter, that all the opinion units are materially correct. So again, the opinion that you're expecting to receive. Management representation letter draft. This again will be signed by your management team, and this is management taking responsibility for the fair presentation of the financial statements. And so all those representations are there for you to review. And I believe that is it. I will stop sharing and happy to address any questions that you may have.
Thank you, Will. Any questions for Will?
Yeah.
Well, it's great to see a clean audit with no identified weaknesses. That should be very reassuring to the board and also to our community as well as our bondholders. So, thank you, Will.
Thank you.
Okay.
I also just want to say thank you, Will, for your leadership and for the work that you did with your team and our team. Very much appreciate the educational piece of it too, and in terms of with the questions and working collaboratively on anything that comes up. So we appreciate that, and I also want to recognize Ajay and Melissa Garcia. I know Melissa really and her team has spent a lot of time and energy and really working hard on this year. And so I want to thank Melissa, especially and her team, but also Ajay for your leadership too. Yep.
I appreciate all of that. So now, we're going to take, the action item related to the audit out of order, and if we could have that motion.
Mr. President, I move that the Board of Directors approve the annual audit report for the fiscal year 2025 as presented.
Thank you. Second. A second from Mr. Wallace. Cheryl, if you can take roll.
Director Nicholson?
Aye?
Director Wallace?
Aye.
Director Yee?
Aye.
Director Stewart?
Aye.
Director Even?
Thank you. Motion passes. The audit is approved. Thank you, Will.
Thank you, everyone.
Have a day and a great new year.
Happy holidays. Take care.
We'll see you in 2026.
Happy holidays.
Thank you. Bye-bye.
Bye.
Okay. We'll now move on to our medical staff report. Is Dr. Berry with us? There he is.
I am.
Good. Welcome.
Good evening. I'm glad I caught the swearing in ceremony at the start. Well, I will just dive into my report here. We have a grand total of 681 members of our medical staff. That's a number that continues to gradually climb. The vast majority of those people, about 2/3 or so, are either active or provisional active members of the medical staff. We also have 53 advanced practice providers who are either active or provisional active on the staff. Another 110 people are ambulatory status and are connected in that way to Washington Health. Coming up next month, we do have 7 new applicants to the medical staff. I'll give more details about those people once we have a completed review of their applications, but 1 interventional radiologist, 1 oral maxillofacial surgeon, 1 ENT, 1 surgery PA, 1 peds nurse practitioner, 1 nephrologist, and 1 family medicine nurse practitioner are all on the list for review. We have several new members of the medical staff to report this month, and I will note that several of these people are family medicine practitioners who are joining under emergency physician associates. Those people are going to help staff our new urgent care center, which is going to be opening, I believe, next week. So the first person on the list is a nurse practitioner named Ira Vergara Amayun. She's a family medicine NP joining WTMF, well, actually WHMF, and she did her DNP at the University of San Francisco. We have another nurse practitioner named Alina Bhatti joining the orthopedic surgery program who will be working with Dr. Sa. She graduated from Samuel Merritt University. We have a physician named Armando Jesus Cervantes. He's a family medicine doctor joining EPA. He completed a residency at Kauai Delta in 2023. Next is Juan Carlos Chavez, who's a PA joining the orthopedic surgery program. He graduated from Oregon Health and Science University. We have Jinyu Chen, another PA who's joining our neurosurgical program, who graduated from Pacific University Hillsborough campus this year. Another NP named Catherine Michaela Donaldson Fletcher, who's joining the Women's Health Specialist Center. She's works with OBGYN, and she graduated from the University of California, San Francisco School of Nursing. We have another physician named Karina Gonzalez, who's another family medicine doctor joining EPA. She completed her residency in family medicine at Bella Vista Hospital Family Medicine Program. We have Jaime Jose Gonzalez Cardona, who's an internist joining Sound Physicians, who completed a residency at Piedmont Athens Regional Medical Center in 2023. Dr. Pavan Khanna is a interventional radiologist who is joining our program, our hospital. He most recently completed a residency at UC Davis Medical Center in diagnostic radiology, and then a fellowship at UC Davis in interventional and vascular radiology. Jennifer Ian Lee is a physician, critical care physician, joining WHMG. She completed her fellowship in critical care at Stanford University in 2024. Gurjeet Singh Mahal is a PA joining WHMG in the cardiology department. He graduated from Pacific University in 2002. Dr. Hasina Nasir is a family medicine doctor also joining EPA, who completed a residency at San Joaquin in 2006. We have Sonia Torres Ramos, who's a PA joining family medicine with Washington Health Medical Group. She completed her training at the University of California, Davis in 2022. We have Lisa Marie Norlander, another family medicine practitioner joining EPA. She finished her residency at Ventura County Medical Center and then did an emergency medicine fellowship at Jackson-Madison County General Hospital. There is Hitalben Naginbai Velanki, who's a nurse practitioner joining family medicine. She graduated from San Jose State. And last but certainly not least is Anila Reddy. She's a pediatric cardiologist who has finished her fellowship at UCSF in pediatric cardiology and advanced non-invasive imaging and fetal cardiology just last year. She's affiliated with UCSF. In other news, as I mentioned, we are opening our urgent care center next week. So we're doing our best to get the word out about that new facility. And tomorrow we are doing a ribbon cutting ceremony on our cancer center. So the medical staff is excited about both of those new facilities and all the patients that will be coming our way. That's everything for my report.
Great. Thank you very much, Dr. Berry. Any questions for Dr. Berry?
Thank you.
We're good.
Thank you.
It's good to see the medical staff growing. You know, the strength of this institution lies in the people who serve our community. So thank you for continuing to grow our staff, medical staff. Appreciate that. And it's good to see a lot of talented people coming in.
I agree. You're very welcome.
Thank you. We'll see you tomorrow. Okay, Sheila, Service League report.
Good evening, members of the district board. I am pleased to share updates on the work of our volunteers. In November, 260 Service League volunteers contributed a total of 1,982 hours across various hospital departments. Their efforts positively impact patients, families, and staff every day. On Tuesday, December 2nd, we received a donation of 108 scarves and 19 baby blankets from the Girl Scouts. This annual tradition is greatly appreciated, and the items will be given to patients to offer comfort during their hospital stays. On Sunday, December 7th, we had our orientation, welcoming 64 individuals to learn about the hospital and the Service League's program. The group included 18 adults, 17 college students, and 29 high school students, bringing a diverse mix of perspectives and enthusiasm. Last week, we also held our semi-annual Masquerade $5 sale in the Anderson Auditorium for 3 days. Many employees and community members joined us for holiday shopping, and the event raised over $8,000 for the league. My thanks go to all the volunteers who made the sale possible, with special recognition for Shri Gamardo for managing and promoting the fundraiser. The gift shop also held a raffle with 4 lucky winners. This month, I'd like to recognize the dedication of one of our long-serving members, Fran Stone. A few weeks ago, I asked Fran to reflect on the meaning and impact of her service, and this is what she wrote. It has been said that patients and their families who come to Washington Health are very appreciative of the friendly faces and help they receive from the volunteers. I've had the privilege of being one of those volunteers for 47 years. I've seen the hospital evolve into a regional healthcare center that serves our community. The hours and years that I've spent as a volunteer are of great pride to me. We are fortunate to have Washington Health here, and I'm honored to be a volunteer. I love Fran's sentiments. Her dedication and commitment to Washington are truly an example to all of us of what we receive back when we serve our community. As we move into the last months of our service league year, we continue to welcome new volunteers and support opportunities throughout the hospital. I look forward to carrying this momentum forward as we close the year with continued dedication and service. That concludes my report. Please let me know if you have any questions.
Thank you, Sheila. Any questions for Sheila? So, Sheila, it was great to go to the $5 masquerade sale. I know my wife and her sister partook.
And your wife and your wife and your wife.
It's a great opportunity.
Yes, and I'm surprised they could find something, and we were able to hold that masquerade sale. We are very proud of Sheree and all the volunteers, and of course, the person who brings the masquerade sale to us. Very grateful.
Yeah, Sheree does a great job. And I love the words from Fran Stone. I mean, she really exemplifies the culture which underlies the Service League. So it's so good that you could honor her this month by highlighting her service and her words. And please extend our heartfelt thanks for all of her great work.
Will do.
Over the years. Appreciate that. Thank you, Sheila.
Thank you.
Take care. Okay, we'll move on to our finance report. Ajay?
Thank you. Reporting on results of through October of this year. So through those 4 months, our stats are somewhat running similar to the previous months. We're running behind on census, but discharges have been closer better than budget. So I think that's been sort of the story. But what that tells us is that our AOL, our average length of stay has decreased, which essentially means, and it's down by about a third of a day, which on a year-to-year basis is a lot. But what that's telling us is that we've got more space in the hospital. Mm-hmm. And as time goes on, I think that will be well utilized, especially in the coming winter months, if we can carry on with this. And for those kinds of patients. But essentially, for the month, our daily census was down about 15 patients. For the year, it's down about 10 patients to the budget. Our patient days were down about 475 from budget. On a year-to-date basis, they're down about 1,200 or so. Our observation days, and you know, we've had this whole work being done around reducing observation and putting the patients at the appropriate level of care. So we're running behind that. We're running lower than the budget, and the length of stay I previously talked about. We're running behind. The good story on the next page is the case mix index. The case mix index, although our length of stay has decreased, is staying strong, and you'll see that in the November data that Kimberly will show in a minute too. And so that's strong. What the case mix index for, just so that you know what that means, is that the way that our inpatient services are coded, it all equates to a weight that's built by a DRG. That's how we bill it to the payers. So every case has a weight, and that weight in our case was 1.656 while we were budgeting for 1.6. Now that doesn't say a lot that it's only 0.056, but it's terrific. It's actually we're moving in the right direction on that. And there's a lot of work being done. A lot of that is dependent on the documentation that the physicians are doing, and we have people we have software and folks who work on that, and that's actually part of the BRG process that you'll hear about more at the next meeting we're doing.
Our deliveries were a little behind budget. Surgical cases were right on budget, which is pretty amazing. Cath lab cases were strong, were above budget. Outpatient visits were a little below, and emergency visits were a little below. Moving on to the indicators, and the cardiac was strong on the surgery side. Orthopedics was a little behind, and on the cath lab cases, we were, as I mentioned, 24 were, of which 20 of those came out of the cardiac service line. On our FTEs, we flexed well as an organization. We were almost 100 FTEs below our budget, 75 of them from the productive side and 24 of them from the non-productive. And on a total FTE adjusted occupied basis, we were better than budget. So we were at 5.93 versus 6.06. Coming to the dollars and cents, we had gross charges of $231.7 million versus a budget of $234 million. The deductions from our revenue were almost right on budget, 76.29% versus 76.47%. And on the year-to-date basis, our gross patient revenue is about $4.2 million higher than budget, and the deductions are almost roughly at the same level. So our revenues, when you go to the next page, you'll see that our net revenue for the year is higher by about $1 million and about $360,000 for the month. Our operating expenses were very close to budget. We were 56.9 versus 56.6 for the month, and on the year-to-date basis, we were even closer. We were $148,000 off. All of that results in a net operating loss in the month of $294,000 against the budget of $342,000 loss. And on an annualized basis, we are about $1.1 million better than what we had projected in the budget. When we get down to the net income after bringing back in our other operating income, we are at a net income of $814,000 versus a budget of $823,000, 1.4% against 1.5%. And on a year-to-date basis, we are about $1.5 million better than budget. I won't take a lot of time on the FASB, and on the last slide that I have on the GASB, I'll just point you out towards the middle of the page. The EBITDA, which is roughly right on budget, we were about $116,000 better than budget for the month, and we are about $1.4 million better than budget on the year-to-date basis. That concludes my report. Any questions I can answer?
Any questions for Ajay? These numbers are heartening. It's good to see that our average length of stay has come down. I think this reflects a lot on the hard work which has gone on within the house to improve the care that we give, to allow patients to go home sooner, to complete their workups more quickly, and to facilitate the discharge process. So that clearly is good. And to do that while still maintaining our case mix index is very promising. I think this will all accrue well to our bottom line, which will allow us to continue to fund our operations, which is why we're here.
Absolutely. Well said, sir.
Well, November, you'll continue to see the length of stay go down, and also with our CMI. But I also do just want to also say, as we know, with November, we're getting into the holidays. The Thanksgiving fell on Thursday. We had a lot of people off on Friday, and then the month ended on Sunday. So it was a little bit of a challenging month from that standpoint. I know the finance team and others, we've been looking at these numbers from that standpoint too. So Also, I just want to say we reordered a lot of the things to start with more of the patient days and that then leading into the finances, more of the gross revenue. So just, they're all there, but they're just ordered a little bit differently this month. So hopefully better tell the story.
Operations first, finances.
Yeah, so in terms of that. So starting with patient days and the trend, as you can see for November, we came in at 4,967 days that were unfavorable to the budget of 5,584 by 617 days or 11%. You'll see we had a lower length of stay, and that was driving it. Year-to-date patient days were unfavorable to the budget by 6.7%, but favorable to last year's year-to-date by 7.3%. Our discharges came in at 1,048. They were unfavorable to the budget by 2.1% or 22. So pretty close, but it was just under the budget. And favorable to November of 2024 by 174 or 19.9%. In the month of November, we had 7 patients that were discharged that had stays over 30 days, ranged from 32 days, and the highest was 71 days. Moving on, in terms of our inpatient average length of stay, as you can see, I think this is the lowest length of stay that we've seen in, I think we might be
a long time.
Yeah.
Ever.
Yeah, so I don't want to ever say ever. So I know that because, The average length of stay for the month of November was 4.54. It was favorable to the budget of 5.22. By 14.9%, driven by lower days, and favorable to November of 2024 by 0.48 or 9.5%. Also, so year-to-date, average length of stay is 4.82, so under 5, which we haven't seen for a while. Also, just as we talked about, the case mix index also continued to go up, which is good to see. So, do you remember from last month it was 1.656? It went up to this month to 1.713.
Really?
So it went up another, I know, 0.057. It sounds like not a huge amount, but as Ajay mentioned, it is. So it's working in the right direction that way. Moving on to our inpatient average daily census that came in at 165.6, which was unfavorable to the budget of 186.1. By 11%, and again, due to lower patient days and unfavorable to November of 2024 by 3.2 equivalent days. Observation day trend continues. As you know, we continue to work on it. Came in at 212, 78 days or 26.9% favorable to the budget of 290, and year-to-date was favorable to the budget by 438 days or 30.5%.
Kimberly, it's just very exciting to compare November 25
Right.
to now.
The work that's been done, yes, and really starting, as you can see, really in March and being able to continue that. So, yeah. As I said, I think the team has really been working on length of stay, case mix index, observation days, those things, which also, though, as Ajay says, there is room in terms of additional availability. As our census rises, we'll be able to accommodate them better. Surgical trends, though, came in for November at 519. They were unfavorable to the budget of 538 by 19 or 3.5%, and very much right on from November of 2024. So inpatient surgeries of 266 were favorable to the budget by 9 or 3.5%. Outpatient surgeries at 253 were unfavorable to the budget by 28 or 10%. There were also 4 TAVR cases that were performed in November. Moving on to the breakdown of the surgical activities, you can see the areas that were over budget: cardiac, gastroenterology, general surgery. We were lower in neurosurgery. Orthopedics was also lower, and urology and vascular are areas of surgical activity. Moving on to cath lab, that came in at, our cath lab came in at 185 cases, was unfavorable to the budget by 7, or 3.6%, and unfavorable to November of 2024 by 5, or 2.6%. Our inpatient cath lab cases at 105 were unfavorable to the budget by 3.7%, and also outpatient cases of 80 were unfavorable to the budget by 3.6%. We did have 7 MitraClip cases and 3 Watchman that were performed. You can see the breakdown really, and it kind of flips because a lot of times we've seen cardiac over, but this month we did have cardiac that was below budget by 25. Interventional radiology was over budget by 20, and neuro by IR by below budget by 4, and vascular by over by 2. Moving on to deliveries, we did have a little bit of less than budget. It came in at 124, a little bit more than last month, but unfavorable to the budget by 10 or 7.5%. Also, 5.3% unfavorable to November of 2024. Year-to-date deliveries were still favorable to the budget by 14 or 2.1%. We did have 2 sets of twins this month, and as you know, our twin deliveries only count as 1 delivery. Our C-section rate was at 29.8% of total deliveries.
Have to ask the mother about that.
Yes. Yes, I know how mother counts them and how our finance department counts them are 2 different ways from that standpoint. All right, moving on to non-emergency department outpatient visits. They came in at 8,402. That was unfavorable to the budget by 374 or 4.3%. And a lot of that, as you will hear, is due to Thanksgiving, and also a lot of the number of departments were also closed the day after Thanksgiving. So lab visits were down basically 11% due to the closure on Thanksgiving and also the day after. And our prenatal diagnostic clinic was also down about 19% due to closure for a holiday, Thanksgiving, and also Veterans Day. So those were really what's driving it in terms of visit trends. And we'll have to look at the budgeting for next year around that too.
But overall, the year-to-date is...
Yeah, we've still been very high in terms of it, yes. Should have said that. Yes. Emergency department visit trends. Emergency department visits came in at 4,937. They were unfavorable to the budget by 324, 6.2%. Also unfavorable to November of 2024 by 1.8%. Year-to-date visits came in at 25,879. Basically, we're consistent with the budget, but down just about 0.7%. So we're still pretty close. And looking at it, we're not, this month we didn't see as many sort of the level 1 and level 2 visits. So we'll continue to watch that. Moving on to our gross revenue trends. Our gross revenue for the month came in at $215 million for November, which was unfavorable to the budget of $230.5 million by $15.5 million or 6.7%. It was unfavorable compared to November of 2024 by $6.2 million. Year-to-date, our gross revenue was consistent with the budget, but down about 1%. That's favorable from last year's to date by 3.9%. You'll see in terms of where it was driven by. In terms of inpatient gross revenue, as you can see, came in at $132.2 million, which was unfavorable to budget by $10.8 million or 7.5%, and $2 million or 1.5% lower than November of 2024. Unfavorable performance, mainly in room and board, again, looking at our patient days being down, and also in surgical services. Inpatient gross revenue year-to-date was unfavorable to the budget by 3.9%. Outpatient revenue was also unfavorable to the budget by $4.7 million. It came in at 82.8 million, really due to less observation days than we had budgeted, and also 4.9% unfavorable to November of 2024. Year to date, though, revenue was favorable to the budget by $16.4 million or 3.8%. In terms of the breakdown of total gross revenue, surgical services revenue was unfavorable to the budget, as you can see, by about $3.9 million or 9.7%. And really that's due to case mix. We had less ortho and neurosurgeries that's really driving that. Also, room and cath lab was favorable to the budget by 4.1%. You can see on the room and board that was down 13.7%, again, due to lower patient days. Birthing center revenue was unfavorable by about 6.9%, due to the lower number of deliveries. And the other track basically with our census. Just moving on to trauma cases, we had a busy month, and I know this December has also started out to be busy. In terms of it, we did see 175 trauma cases for November, which was favorable to the budget of 151 by 24 or 15.9%. Also favorable to last year by 10.8%. In terms of looking at year to date, our cases were favorable to the budget by 16.1% or 121 cases. Inpatient trauma cases of 59 for November were favorable to the budget by 13.5%, and outpatient trauma cases of 116 also favorable to the budget by about 17%. You can see the activation, the trauma cases by activation codes. We have 11 the alphas, 49 bravos, and 100 deltas. Basically, in terms of the cases, we had about 88 falls, 48 motor vehicle crashes. We had 16 other types of cases, computer laceration, stabbing, 9 pedestrians that were hit by vehicles, and then 8 bicycles. So a wide range. But then one of the things, just looking at the next page, is our gross revenue. For November, it came in at $18.4 million. And really, in terms of where that's, given our higher volume, we would have thought to have more of that gross revenue. But really what we've been seeing is in terms of the inpatient trauma gross revenue, we didn't see as many surgical cases.
Yeah.
So that's really what was driving, even though our volume was so high.
I think the thing that really piques my interest as far as the trauma numbers are just the number of falls.
Yeah.
Half of our trauma is falls. It's probably less of the alphas and mostly bravos and deltas. It still is just a huge number of patients, and the burden of trauma after a fall is so high. It really impacts a lot of patients' lives very significantly. So that's one thing I think we need to look at and work on and see how we can community education, having people understand the risk.
So I know that we have our team that's out there, but it's something we have to continue to work on.
It's going to be an ongoing challenge as we get older and less active.
Moving on to our payer mix. As you can see, overall government payers came in at 76.1%, unfavorable to the budget of 73.5%. We did see less Medi-Cal patients and additional more percentage of Medicare patients, 4.7%, compared to the budget of 51%. HMO was came under budget at 2.2%, unfavorable to the budget, which we had budgeted at 3.9%. PPO was pretty much on at 20.1% compared to a budget of 19.6%. And you can see also with self-pay and TRICARE. Moving on to our productive FTEs, I will say we didn't flex as well as we did the previous month. In terms of, you can see with productive FTEs for November, they were unfavorable to the flex by 18 or 1.2%. Came in at 1,482.8 FTEs. Looking at our non-productive, they were favorable to the budget by 27 or 12.6% at 214.6 FTEs, but unfavorable to November of 2024 by 39 or 20. Then looking at our total FTEs for November, they were consistent with flex, basically by 9.5%. So overall, pretty close at 1,697.4 FTEs, but unfavorable to November of 2024 by 3.6%. I will say, looking at our total FTEs for adjusted occupied beds, remember October was under 6 at about 5.93. We did come in over 6 at 6.22, so that was unfavorable to the budget that was at 6.02, so by 3.3%. All right, moving on to radiation oncology. For November, radiation oncology treatments were quite a bit lower. They came in at 199, unfavorable to the budget by 35%, also unfavorable to November of 2024. We averaged about 11 treatments per day versus about budgeted 18 treatments. Talking and looking at the numbers, we've had a number of patients. We had about 9 this month that decided either not to get treated or to wait, which is a high number compared to other times. So we think that there's been, for various reasons, that either patients are electing to basically hold or to not or go for radiation.
We need to understand why they might be making those decisions.
Yeah, we can take a look at that. In terms of the consults, they still are continuing to be strong. They came in. We had 24 new referrals that we're seeing. We had 21 new patients seen in the clinic. The conversion rate is about 13% at this point, but as you know, it takes time in terms of those deciding whether or not they're going to get treated. Moving on to Washington Health Medical Group, the clinic visits were unfavorable to the budget by 5.2%, and year-to-date unfavorable to the budget by about 2% also. 5.2% for the month and 2% for year-to-date. Unfavorable was mainly driven by some of the providers that have left. We had, resignation in ENT and then also in OB. So we've also had one provider that left the Danielson Clinic. We have put somebody in there at this point, but as I said, a lot of that's driven by providers leaving. We are actively recruiting and working on OB and primary care or two and ENT, but ENT is a challenging recruitment, so that we do have recruiters that are working on. Development Corporation visits came in at 2018. They were unfavorable to the budget by 35 or 1.7%. We had Washington Outpatient Rehab Center visits were basically consistent with the budget, or a little bit more by 8. We had 1,418 versus a budget of 1,410. Lost cases were unfavorable to the budget by 41 or 7.3%. Basically, that was driven mainly by less gastro cases that we saw. And then PSC was unfavorable to the budget by 2 or 2.4%. We did have less pain management cases, that we had more ortho cases. Moving on to our days cash on hand, as you can see, it decreased to 102 days in November. This was primarily due, we had an IGT payment that was due of $11.3 million for our voluntary rate range program. So that was really the main driver. We do expect that we will be getting in December or January about $25 million that will be coming back into the system, so that will help to drive back up those days. I do just want to mention that we do in December also have our semi-annual bond payment that's due. That's about $4 million, but really this has been driven by the IGT. You can see where charity care falls is about $107,000. And then for November, our AR days continue to be trending down to 51.9 from 53.4 for the prior month. So that's also lowest level since May of fiscal year 20.
Do you think our days cash on hand will fall in December or be?
It really depends on when we actually get the rate range
25, yeah.
money back into it. So as I said, we hope that it will be going up, that we do receive it.
Yeah, our hope is that we will get the money this month.
Yeah, it is December, yes. Yeah. So, we're keeping our fingers crossed on that.
Keeping my fingers crossed.
So if you look at, like is there something seasonal that goes on in the springtime? You look at the big jump in, as between February and March, April, May, is there some kind of seasonality that days cash on hand?
I'd have to go back and see what happened last year. I think some of the, when the cash comes back from the IGTs, that will drive up our cash. And I think the big one is right now, and I think there's another piece that happens later on in the year, around like March, April, May.
There's the rate range and QIP stuff.
Right. So that's a piece of it. Another piece is I don't think there's any bond payments or anything else that are happening during this time, so we're able to
hold on
to build up our cash reserves and then start paying out. But it's a good observation.
Well, yeah, hopefully
Yeah, I'd love to get it up to 139. I don't know that we'll get there this year.
Well, I know.
But we will get there.
No.
I think our IGT payments have gone up. I know we get additional dollars back, but it's also more going out too than we've seen in the past.
Yeah, last year it was, I think, close to $9 million that went out. This year it was 11.5. So,
as long as we get it back and more.
Right. Yeah. But ultimately,
it's not a bad thing.
Yeah. Ultimately, these are the things that will get impacted down the road through HR 1 too.
Right.
Yeah.
So. Okay. Any other questions for Kimberly on the? Appreciate that.
All right. Move on to Employee of the Month and then the calendar. Very excited to announce that our Employee of the Month for December is Maria Contreras. She is our lead financial counselor in patient financial services and really plays an important role in the health system in terms of helping to work with patients who may be uninsured or underinsured and helping them to find insurance. So in her duty, she joined Washington Health in 2007 in her role as financial counselor. In her duties, Maria supports patient financial services and our patients with applying and securing medical coverage for those that are in need of services and are uninsured. Maria is known as a top-performing employee, recognized for her skills of compassion, professionalism, and integrity. Maria goes above and beyond to assist our patients with financial assistance or providing a calm guidance through the stressful situations of needing to seek medical treatment. Anyone that has ever experienced meeting or working with Maria has nothing but delightful feedback to share. She demonstrates the characteristics of a winning financial counselor through her compassion and integrity, her professionalism, and being a team player. She strives to ensure that our patients feel heard and experiences excellence in service each and every time. On a personal note, Maria is very passionate about family. She is dedicated and cheerful in providing Washington Health family support, and she is also a cherished mother and grandmother who loves experiencing new adventures as a family. Maria loves to spend time with her dogs, Little Bear and Molly, taking them to the park or snuggling up to watch a good show on television. Brad, congratulations to Maria for being Washington Health's well-deserving employee of the month. Today, yeah, that's why I kept looking at it. We weren't sure that you might get that this for today. I know. Today. Hell, yeah. We're very, yeah, that's great. Good job.
Exactly.
Good job, Sheree.
Thank you.
Good job with the photos.
All right, let's move
Photoshop
on
is really
to the health promotion and community outreach event, starting in November. I do just on November 19th, Dr. Cotta, our endocrinologist, did Managing Gestational Diabetes, a Healthy Pregnancy Journey. We had over 1,000 views on Facebook and YouTube. Also, once you can, as you know, Kayla Gupta has been talking about our community health needs assessment, did that at the Union City Family Center. November 20th, also on November 20th, we hosted Beyond the Bridge, a film screening in collaboration with Fremont Council member Kathy Kimberlin and United Way Bay Area. We had over 200 attendees for that.
What was that?
That was a film about homelessness and how different cities are dealing with it. So it was really a discussion about the options about, how going forward in terms of film. And you can see on the 28th, we were participation in the Nile Festival Light Parade. Also on December 1st, we had our holiday tree lighting in Anderson Auditorium with over 50 attendees. December 3rd, Dr. Daniel Raper from Neurosurgery talked about endovascular treatments for stroke, and we had close to 950 views on Facebook and YouTube. And then also just another Newark tree lighting on December 5th. Touching on a few and see the pictures from the screening. We also had a number of panelists there too.
We all had our wish list.
Naughty list?
Pretty much.
Yeah.
For prosperity and good health.
Check.
Yeah.
Yes, exactly. Just highlighting a few things. On December 11th, tomorrow, we have the Washington Health Walk, Stress Management, the Nakamura Clinic in Union City. Also tomorrow, as mentioned by Dr. Berry, we have the UCSF Washington Cancer Center open house in the Anderson Auditorium. So very excited for this ribbon cutting, and then we hope to be seeing our first patients in January. So it looks wonderful there. Also, just January 7th, Garrett Cordis, our injury prevention coordinator, is doing pedestrian safety, just talking about, again, whether it's falls and other things, and he's going to be doing a health walk at the Mark Green Sports Center in Union, too. Based on some of them. Then again, we've talked about the tree lighting, and on Giving Tuesday, the foundation celebrated by showing appreciation to our community for all of its support. And we have the next foundation's annual meeting on January 27th. And that is my report.
Great, thank you.
Calendar.
Any questions or comments? If not, we'll move on to might be the best part of this meeting, which is our action item. Yeah. And so this is item B, consideration of Resolution 1277, declaring the results of the vote cast on Measure B at the November 4th, 2025 special statewide election. Jeannie, if you could make a motion.
My pleasure. Mr. President, I move that the Board of Directors approve Resolution number 1277, declaring the results of the vote cast on Measure B at the November 4th, 2025 special statewide election.
Second, third, fourth.
All right, so we have a second from Dr. Stewart. Mike is smiling. That's good. Cheryl, if you could take the roll.
Director Nicholson?
Aye.
Director Wallace?
Aye.
Director Yee?
Aye.
Director Stewart?
Aye.
Director Epen.
Aye. That motion passes, the resolution is adopted. And our profound thanks to the citizens of the district who voted for this, to allow additional funding to come to this institution for operations and providing the care that we deliver in our trauma unit, ICU, and throughout the whole system. It is such, there's just a tremendous sense of gratitude I have for the community for being this kind and good. And I have to thank all of the individuals, including Mr. Wallace, who led the campaign to get the word out there to inform the voters.
Well, it's been said that you see a turtle sitting on top of a fence post, you know he didn't get there by himself.
Right. Well, we thank you, Mike. It was great work and tremendous gratitude, and it'll help a lot.
I think we need to recognize that it was a significant positive.
I believe it was 65 point.
It's in the resolution.
It's in the resolution. I remember seeing it. 65.2. Okay. Very good.
Yeah.
That's a remarkable.
57.
It truly is.
Well, I think it's a reflection of what the community thinks of us, confidence they have that their money will be wisely used for the good of the community and not diverted to some corporate entity somewhere else. It's just a wonderful thing to have happen.
Yeah, and I think I want to acknowledge all the people who signed the petition to get the measure on the ballot.
Right. Truly a whole community effort.
And it created this additional awareness.
Yeah.
It's necessary.
I think that's one of our big challenges for the years ahead because our community is growing and changing, is to let people know who we are, why we're here. And part of our new media campaign does address that, why we're here.
Yeah. Why, and the importance of having an independent community health system.
Yeah.
Right.
Yeah.
Very good. Very good. All right, so that's passed. So, Kimberly, do we have any announcements?
I have one announcement. Okay. And I know Dr. Berry mentioned it. I do want to say that our urgent care is opening on December 17th. Yeah, she's just shaking her head still now. Yeah, and so it is open 7 days a week, from 10 a.m. to 8 p.m. Monday through Friday, and 9 to 5 on Saturday and Sunday. We take walk-ins and scheduled appointments. We have X-ray and lab, and so we'll be putting out more information, and it is located in the Washington properties next to Walgreens, so on the other side of Washington West. So we're very excited. I was over there the other day, and
great. Yeah. That's wonderful news.
And it's taken a lot of people working on this, and so whether it's
patients are asking.
Mike Rogers and his IT and the medical group and many others, as you see all the physicians coming on board too to help to support it.
So if a busy person wants to get seen in the urgent care that day, is there a place that they can go to on the website? Yes. And how do they find that so that they can say, I'd like to be seen at 3:45?
Yeah, so the website will go live the day we open. There is the ability for them to go on site where the urgent care page is, and they'll be able to click on available appointments and be able to make an appointment.
So WashingtonHealth.com, then urgent care. And you can come on down. Very good. Okay. Thank you. No other announcements?
No other announcements.
Any other business to be brought forward before this board tonight? Board members? If not, there's no need for a closed session, and this meeting is adjourned.
Yay.